Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Coronary steal phenomenon. Coronary steal phenomenon. In coronary steal phenomenon, the drug called as dipyridamole. Okay, what does this dipyridamole do? This will dilate the subendocardial coronaries. So it will dilate the subendocardial coronary arteries. These subendocardial coronary arteries are dilated, which are present in non-ischemic zones. So as a result, what happens? The blood from the from the ischemic areas will go to the or will the blood from the ischemic areas will redistribute, or they will go into the non-ischemic areas because of the dilatation of the uh, coronary arteries in the non-ischemic zones. So as a result, the blood which should go into the ischemic areas and which should decrease the problem, or which should increase the blood supply. Always whenever there is ischemia in an area of heart, we should try to increase the blood supply to the ischemic areas. But in dipyridamole, because it dilates the coronary arteries in the non-ischemic zones, so the blood from the ischemic areas is diverted into non-ischemic areas. So there is less amount of blood is present in the ischemic areas, so obviously it will worsen the angina effects. So this is mainly caused by the drug dipyridamole, whereas this coronary steal phenomenon, it is not caused by nitrates. So it is one of the advantage why nitrates are used for uh, angina rather than dipyridamole. So dipyridamole can be called as it is a pharmacological success, but it is a therapeutic failure because it cannot be used in therapy, but it is successful based on the pharmacology.
thank you and thank you for watching.